leaders, which could be religious leaders, social leaders, etc. And finally, very, very important is the in-person reinforcement or reminders. This is like a critical part of the intervention. So we really need to make sure this is being done well. What we've done is we've put together, this is the process that needs to be followed with some indicative timelines, depending on how quickly, fast you can move. Of course, that's different. And just to let you know how to sort of navigate this, so you can see that, you can click on any box and then you can go to that section. Yeah, that section also has the links to all the script. And when you're done, you just click back and you can get to the box. So that's the way to actually navigate. You don't have to read the whole document. You can just go to one.
So Neela, actually, if can we, maybe choose one of the boxes and let's go through the detail of.
Yes, I'm going to go through that. Yeah, exactly. So there are 4 sort of areas. We've said there's some preparation that needs to be done, then some field preparation, the actual activity, what to do in weeks 1 and 2, and then what to do in weeks 3 to 8 is what we've said typically for an intervention, but that could be less or more depending upon how the surveillance goes. So let me get to one of those. Let me get to, for example, the household distribution and show you what this would actually look like. Okay, so we go to section 3.2. Okay, so what we do is we have a protocol. First of all, there's a sort of safety protocol that has to be followed, which we've included in the presentation. But here's a protocol of what needs to be done before going to the field, making sure that this kit is ready with each of the promoters, which is what we're calling the community people who go on the field. And you can see that it's, mask wearing, hand sanitizer, masks for distribution. We've given some guidelines as to what that could be based on Bangladesh experience, but obviously that can be tailored. The video brochures, and I'll run through that, a letter of authorization and a script. Okay, and I'll run through each of those as we're going through the protocol. So this is what has to be ready before going into the field. Then we give a protocol as to what happens once one is in the household. So for example, the promoters will ask to speak to an adult household member. In the absence, they will speak to adults in the order as more influence in decision making. What we've included is a sample script from Bangladesh, which of course, will be customized depending on definitely your experience of doing this. So if you see this, if you see the script here, there is an actual sort of script which says, hello, actually, let me just link to it, sorry. You'll see the script which says, this is what it is. This is literally like the sales script. What we obviously say in the training part, which is one of the boxes, is that while the promoter should know the script, they shouldn't read it out. Obviously, it has to be said in a very conversational manner. So in this case, you're explaining what it is, why we're giving the household masks, and then we have a link to the video. Now, in this case, we made a video in Bangla with the Honorable PM Sheikh Hasina, the National Imam, and the cricketer Shakib Al Hasan. We'd recommend a similar video, and we can talk about who's making that and what is the way to do that. But we have the actual video and we have a translated script of what that video says, so that if you want to make a similar one in India, you can make a similar one. Then they talk about, what happens with the coronavirus. We leave behind a brochure in the household. So this is entire script that needs to be followed. So that's
one further level of detail just for the team in Gujarat, that we have other partners now working with us, such as CSBC, Center for Behavior and Social Change in India. And then, there's also now partners we've picked up, like UNICEF, WHO in India. They also want to participate, right? So if there is specific things that need done, so for example, let's make a brochure that's based on existing evidence in India, right? And let's adapt the Bangladesh brochure and do that. Or just simply, we can take the Bangladesh brochure, but we just need to translate it into Gujarati and Hindi, etc. Right? So we can also provide that level of detailed support, but so we should just keep lines of communication open on what would be most helpful. Like, what are the things that you'd want to do internally, what you'd like our support with, and we can provide it.
So we also state, because this was quite important during COVID and our infectious diseases specialists, but of course I know there are many doctors on this call. So one thing we do say is please modify this, and make it even more conservative from a safety perspective. We do not, we really advocate that, but here are the precautions we told the promoters in Bangladesh, as well as give some guidelines on those precautions. So I'll just go back. So for each one of these boxes, there's similar details, as I said, with the scripts. So we put down what we think it needs to be done. Procure masks, as Mushfiq said, produce the messaging materials, and then we can decide who does that. Align on the safety protocols. We actually have, we already have some of those protocols written out. Including a symptom checker and supervisor guide. So, we just have to look at that and see what makes sense in this context. Anything needs to be modified. A person did look at it and say that it was fine. She understands the situation. She was actually in Bangladesh, but just in case, you feel that there is something else. Purchase any equipment. We've given some details about what we used in Bangladesh. Obviously, this is not necessarily something that needs to be done for everyone, but this is just helpful in case this is the kind of equipment as well as the specs. Our team is on call to talk a little more about the specs that might be required. In terms of field preparation, identify the public gathering areas, plan and select promoters. We have put down a few things about what the role of the promoter is, what the role of the supervisor is, what we would say is the daily routine of the promoter. And we can also help you once you've, I know there are certain districts, Anand, Surendranagar, etc. If we know what the area is, plan the personnel based on what we used. So we are happy, I think, to provide a bit of support on helping to plan what personnel might be required. There are some learnings from our Bangladesh team about what was helpful in predicting good promoters. And there was some variation. So this was a trial and error learning. And so I think this is important, and they're happy to talk about this a bit more, as well as what, of course, in the RCT, the staff were paid depending on what, but we definitely recommend, obviously, health insurance and COVID testing. So we have that. So plan and recruit promoters, list the community leaders. I think this is something you will know much better than we do, but we put down some ways in which we listed those. Importantly, we've put a sort of how would you plan, we think that if this has to work well, then there should be a little bit of light monitoring as we're doing the intervention, so that we can then course correct and see what to do. So we put on a very light plan on surveillance and observation. This is not the randomized controlled trial that the researchers did. But we're also, and we've talked about what that could be. So a protocol around what we talk about when we mean surveillance or counting mask wearing. This is quite important because in the research, when you asked people, they typically reported very high levels of mask wearing. But when we actually observed people, then that level of mask wearing was much lower. So I think it's important to do some kind of observational surveillance for this. We've also put down, I also put down a little box here because a best practice obviously would be to do it with a comparison group. But we understand that that makes, this data collection very tricky. And I think Mushfiq and his team are on call to help with any technical advice around data collection and data monitoring, as well as, to brainstorm about partners who could do that.
Yeah,
So
and a quick point here, I'll just interject, is that, yeah, as we said from day one, our main goal right now, given the situation in India, is like, let's just go ahead and implement and do it in the most, take the path of least resistance and get masks out to people, right? Something that I just learned, I mean, we were just on a call with WHO and UNICEF, and they were saying, oh, we want to do the advocacy, right? So what we'd like to see is that, okay, we're convinced by the Bangladesh results, but we'd like to see if this is working in India or not. So to the extent that while we are doing this intervention, if there's some light touch monitoring we can do in the background, right? Where, the light touch monitoring would be something like, let's just have some observers, right? Like who are doing passive surveillance. They're standing around the street corners to see where you've done your intervention relative to a comparison area where you have not yet reached, right? What is happening to what is happening to like mask wearing rates. So if we just track those, I think it'll be helpful for advocacy. So I heard they're talking to Niti Aayog, right? And maybe that'll help us, scale this across India a little bit faster.
And then we also have a little bit of a training manual in terms of, and we're updating this. We just got it. It's in Bengali, so getting it translated. But a little bit of a training manual because there were some learnings that the Bangladesh team had actually. So not just and I think Gautam, you'd asked about this, not just a one-time training, but they did find that you need to do a refresher training based on some learnings in the field. Then, as I said, the actual field activity. So we do have all these scripts about, what happens when you meet with the community leaders and as I said, the household distribution, which I took you through. Meeting with the market and religious leaders. And then this is a really important part of the intervention, which is the in-person reinforcement, which is the point at which people are standing in these public spaces. And if they see someone who is not wearing a mask, then they are actually going up to them and telling them to wear a mask and handing out some free masks. Because this is not necessarily what we do in our daily lives. Obviously people need a script for this. And so we've actually provided like a script of what they could think about or say, but obviously they'll do it in a conversational manner. But we think that there's also a little script for an audio, and we actually have the audio which they played in the markets with permission from the market leaders. Just a little announcement that says, please wear a mask.
Neela, is it possible to just play it for us for just like a few seconds?
I have to.
Oh, okay, then don't worry.
Yeah, I wish I could. Niti just sent it to me last night, so I'll add that to the list of things, but you can see that the audio. We also have the very specific things here in terms of what precautions the market promoter should have. So this is the part I think that, we'd be very happy to work with you to make sure this happens, because this is normally the part that we haven't seen happen very systematically or in a lot of the interventions. So the household door-to-door distribution, the role modeling, that happens, but not this sort of in-person reinforcement. So how many people should stand? Where should they be? How should they give the mask? What should they approach people with? I think that's important and a new part. This happens typically in the first 2 weeks, and then, continuing the in-person reinforcement. So in terms of surveillance, we said ideally, and by surveillance, I mean a very light observation. There's a baseline that happens before the intervention starts to know, what's the mask wearing. There's a second round that happens maybe about 2 weeks after the intervention begins. And basically the idea is to course correct. Now we are seeing from our example in Bangladesh, it should increase mask wearing, you should start to see levels of mask wearing increase, but if it's not, then what happens? Let's do some more retraining. Maybe one of the learnings was that they then had to go back and talk to the local leaders. This is where the supervisors come in. Solicit more active involvement. And in some cases, they had to find leaders of other demographics, for example, female leaders or youth leaders. And we also recommend a final wave after one set of interventions increases. And I say one set because, we don't know how long this is going to last, right? It's not going to be, we do this in our study, we did it for 8 weeks, the effects persisted. But of course, we're not saying you just do one intervention for 4 to 5 weeks and then it'll just continue for the rest of the year. People have to be constantly reminded. So every time an intervention ends, it would be great to do that. We think that the mask use should remain at elevated levels. And then, of course, community leaders need to continue support. So finally, sorry, I'll just end with one last section of this, which we'll keep adding to, and the team will look at it. We put down some lessons from the intervention in Bangladesh, and we'll sort of keep adding to it. And, I think this should be something that even the SEVA team, you should add to it from your lessons in India. These are really, it's not just statements, but actually these are things that really mattered. So if possible, we should try and incorporate this. This is what the team tells us over and over again, actually mattered to the intervention.
So one other point I want to underline And that is that, the primary distribution, as we discussed during our last call, remember, that you already have a group of association members who are stitching masks, and this is a livelihood opportunity. And that sounds great. And we should be using those cloth masks as our primary distribution. However, one of the things we learned in Bangladesh is that when we are sort of doing secondary distribution, maybe in the mosque when somebody shows up and forgot their mask, or in the markets when somebody shows up, forgot their mask, or when we intercept people on the street saying, why don't you put on your mask? They said, I don't have one. Okay, so here's a replacement one. So maybe those replacement masks, we can have a batch of some surgical masks, which are cheaper, so that you don't have to like waste so many of the nicer cloth masks, right, to give it to people, right? And then, and if people find, oh, they're going to be nice cloth masks, they're going to hand out if I claim that I don't have my mask, right? Then we might have a problem of like generating too much demand for the cloth mask. So perhaps we should also think about, like, is there a way for us to do some procurement of not the primary, but like a secondary set of surgical masks? And we can certainly help you with that too. Like, think about, so just as an example, we already have some negotiation conversations with Magnum in India, and have a contact information there if you want to use them, or we could use this supplier we used in Bangladesh. So I think that's going to be important, and that might be a new dimension to what you already have planned. And I'll stop there. So maybe we should have the team from Seva now talk about their reactions. And
So just wanted to know, are there any questions about this? Anything that you're missing? Sorry, we are doing this, we need to do something else, or we are currently engaged in, or some help that you need, or more. And we did look through, thank you, Sahil, for the protocol we sent. So we did look through that. I think that protocol very closely matches what we've put here with, and this has a little more detail, but happy to sort of take a closer look and see.
And just to let everybody know, everyone's on mute in case you are talking, we can't hear.
Reema. So first of all, thank you so much. I think for having this call immediately as well. And I think what we have planned is that from 30th, so 2 days from now, we would be starting the distribution of the masks in the villages. So everybody has identified who will be the leaders who would be distributing, how many households in a village they would be door to door going and distributing. All those things have been worked out. So, but as you rightly said, that, to have a backup of surgical masks, or I may not be using the right terminologies every time, but so if those contacts could be given, that will be definitely be helpful. The second thing, that we also are working very closely with UNICEF and WHO. So who are you talking to? So if there could be a sort of a coordination, then it just doesn't happen that we talk to a different set of people, and then you were talking to a different set of people. So just that much.
Yes, Siddharth Shrestha was the person who...
okay, you're talking
to
Sid
and Alka. Yeah.
Okay, sure. Yeah. So we're also talking to them. So Sahil Bhai knows him very well as well.
Okay. Yes, I worked closely with him, Sahil Bhai, when I was at CSPC. So yeah. Sid and Alka Malhotra, and I think Lopa Mundra is also in that conversation.
So yeah, we are working closely with Sid and with Lopa Mundra.
Okay, great. So, we are sharing this one. We sent this out to you first, just in the interest of time, but we'll be sharing it with them right after this call. So then everyone's on the same page, and I think they could provide some help on the video and the brochures. And
yeah, so I spoke to them about this. I mentioned that Seva has some, tangible plans, and then the government of Gujarat, government of Telangana have other plans as well. So then we mapped out, where are they working and what type of support they might be able to provide. So I mentioned to Sid and his team, both at UNICEF and WHO was also in the call, that we'll talk to each of the organizations that are implementing. We'll have them lead the conversation, and if there's some gap that they can fill, they're happy to do it.
So Mushfiq bhai, I just had one question. That this is an extraordinary situation now, and we may have to really work so fast that sometimes some of the steps may be jumped as well. So how does that affect the adoption or anything? So that was my question.
Yeah, no, I think that's completely fair, and we really should, and in fact, we probably should be jumping given how critical the situation is. And I think the best way for us to answer that question is, let's just do a little bit of light touch monitoring, right? So that day upon day, we can just track a little bit, right? Maybe we can set up some kind of an MIS system to do the tracking, and so we get the data very, very quickly, right? And on a daily basis, we can have research assistants like look at the data and analyze it and draw the graphs necessary for us to see, okay, where is it working, where is it not working? So on a daily basis, we can provide feedback, right? And we might see that, okay, some, maybe in Rajasthan is working better than in Gujarat when you're doing both, or that some districts is working better than others, right? And then we can immediately have the conversation with the supervisors in those districts saying, okay, what's going wrong here? And adjust accordingly. I think the best way for me to answer the question is that it's unknown, right? And therefore, like, some monitoring is critical.
Sure.
So, Rimaman, if you're done, can I ask a couple of questions?
Even if I'm not, then you can please go ahead.
So yeah, first of all, thank you so much. Like, I think this is a great repository of information. It's been really, really helpful, and it was great going through all the material that you had documented there. One question from my side, just to build on what Rimaben was asking about the monitoring aspect. Is it possible to have the same people do the monitoring as the ones doing the mass distribution, or should we separate the two roles?
I think for more rigorous data, it would be nice to have some separation. So for two reasons. So one is you don't want all the targets, like the rural residents, right? You don't want them to only put on the mask when they see someone watching them, right? And so it would be nice if there's a separate team that's roaming around, and they can do their job much more quickly. So I think their roaming rates across the district and across the state will be different anyway, right? Because what will happen is that maybe they go to a village and they just need to go hang out at a tea shop for 1 hour, right?
Yeah.
And we shouldn't even put any like hats or t-shirts on them. They're just like regular looking folks. They're having tea, and they're just noting down what proportion of people are wearing masks, right? And whether they're putting it on correctly. Okay, so that's one reason. And the second reason, as you understand, is that, look, we don't want the person doing the intervention, like doing the task, to be evaluating themselves, right? Because of course, there's going to be some possibility of implicit biases there, right? And so that's another reason that separation would be good. And I think logistically it makes sense. So what I would suggest is that, okay, let's say you have a team of 10 people, right? Just hold 2 of them aside and say that your task is to roam around this district at a different rate, right? And one way to maybe manage our human resources better is, imagine that you have, the monitoring can also happen periodically. It doesn't have to happen every day, every hour, right? So what can happen is that, let's say you have a team who's worked in District 1, they've done the intervention, right? But they're free the next couple of days. So you can send them to a different part of to District 2 and do the sipping tea and monitoring there, just so that they're not associated by those villagers as these guys who gave the masks. Right?
And when you do the observations, is there a checklist or a certain performer that you used to follow for the
Yes.
observations?
So we
Yes.
do have some guidelines, and I think we can make a small template in terms of, you can use the ones that we use. We do have that, which we can
Right.
also add to this one. But we have
Yes,
guidelines on, like, here's, how many different locations, this is the thing, spend 1 hour, this based on all our, and then don't approach anyone to ask why they're not wearing a mask. So your job is only observation, not to,
Right.
because there's a temptation to do that. But we can also, I think, to make it easier, just make a short sort of like a form or a checklist for them to, fill out.
Right.
And
And then on the frequency with which they have to submit the form, on the frequency with which we have to compile the data, I think even that would be really helpful with the
So
monitoring.
I'm just adding those points in here so that I remember, and we can sort of get that also.
And would they have, like, if they have smartphones on them, right, or tablets that the organization has anyway, like we can also try to work on sort of programming a little, like, data collection so that they can use that for, the tablet or the smartphone, and then that gets uploaded directly. So that way, the data comes in real time and we can provide feedback really, really quickly. So so one of the things I've learned is just by, like, reaching out to people, there's an immense amount of talent all across South Asia, across India, right? And I can imagine, being able to find somebody who can, like, quickly program up something on a smartphone for us for that. So let's also keep our eyes open for that.
Sorry, go ahead, Moshe. Go ahead.
Yeah, that was it.
No, so even something like Google Form
Correct.
might work. The only caveat is that in some of the rural areas, the internet connectivity might not be
connection.
so.
Correct.
Yeah, so perhaps we should think about something that can be done, like it works offline, but then as soon as you connect, it gets uploaded or something like that.
So that was one part of the question. And then the second question that I had was with the entire challenges that you have seen. I know in the web page, you had mentioned some lessons learned, but any situational challenges and like specifically if there were certain situations that were unpleasant or that our team just needs to be prepared for, what were some of them and how did the team in Bangladesh handle those?
Yeah, I will give you a little bit, but I do think we need to get the team in Bangladesh to weigh in on this. So Heidi, let's get them. If anything, we'll follow up with an email with some of the list. But I remember asking this question, and the nice thing was that it was a very, very infrequent occurrence, right? And in fact, while we're talking, I'll try to find that email. I'll read that out to you. It was infrequent, and then the main solution, right? This is why when we said engage with community leaders is very important, right? Once you have even though the community leaders may not be actively doing something for you, right? Just having their blessings, so to speak, right? In advance, it doesn't even have to be written, as long as people know that, oh, you know what, I spoke to in Bangladesh, the UP chairman or the UP member who lives here. They know what we're doing, and this is why we're here, and we're doing it in conjunction with them, right? Just being able to say that has been very helpful. So therefore, I would strongly suggest that think about, who are the leadership types, right? And it may be informal leaders, like in Bangladesh, it would be like an elder who does shalish, like an informal dispute resolution, right? So that type of a person, it could even be just a school teacher who lives there, right? And take some time to just talk to them in advance, explain what is it we're doing and why we're doing it. Okay. And once you have their blessing, then you can just, like, anything comes up, you say, you know what, this person knows, can you talk to them?
I just wanted to add, and this was exactly actually what the refresher training program they did. So you can see here that they have some questions. What should you do if someone says coronavirus isn't a problem in their village? There's some sort of script. What should you do if someone suggests arranging a meeting to increase mask wearing when you know it isn't? What should you do if you see young people are not wearing masks? This actually all came out from the field when they were doing the research. So similarly, I think we can get some more other situations. These are the main situations. And that actually led to that kind of refresher training. How can you engage? One of the difficulties was actually engaging community leaders. And they found that some of them were not mentioning that surgical mask is washable. So there were a few other things in terms of areas of improvement the supervisors thought of. But we can get more details from them. But these were sort of the main objections, I think, that people had. They thought it was not a threat in their village. They said, let's have a big meeting to talk about this when, that's not very safe. They, how if you see children, what should you do if you see children not wearing a mask? Should you go up to them or just restrict it to adults? So these are some of the situations that came about.
So, Sahil bhai, let me use an example from actually outside the project, because it turns out, luckily for the mass project, we didn't face much, big problems like this. But let me use another example from another project we did in Bangladesh, because sometimes unusual things happen and we have to be prepared for it, right? So we were doing work on like migration in Bangladesh, like tracking the effects of some international migration. So we were sending, and there were these people in various villages who had participated in a government lottery, right, to get a visa to Malaysia or not, right? And we were tracking down their household and asking questions about how they're doing now to see if that migration opportunity helped them. Okay. Now it turns out one of the people who lost the lottery, right, then had given money to like a middleman. And there are all these fraudulent middleman companies, like migration facilitation companies, right? And this guy had kind of like come and taken the money and then disappeared, right? So then when we went into the village and started talking about, oh, can we talk about the migration experience? Did you participate in lottery? Like somehow the neighbors said, oh, this guy is connected to that fraud, right? And that creates it's like a completely random occurrence, right? And so that's the type of unanticipated issues that sometimes come up, right? And so similarly, if there is a case here where we're talking about the importance of COVID safety, etc., and then somebody says, you know what, I tried to take my relative to the hospital and you guys didn't admit him, right? If they make that connection. I mean, people are understandably emotional at this stage, right? And this is again why like having the local endorsement, the local leaders, I think is important, so that because there might be things that are so kind of out of left field that it's impossible for us to even anticipate and plan for. And definitely like field level staff, it's not good for us to rely on them to like problem solve on the spot. So let's get the leaders.
Yeah, and of course you must have tried this, but it might be worth it creating a small WhatsApp group while the intervention is happening to surface some of these concerns, so that we can understand the situations and then see if something similar happened, or it's just good to know what's coming up in the intervention.
I also just wanted to reiterate a point that Mushfiq made, and just kind of thinking a bit big picture about it, looking at all the different components, right? I hear a lot of them already in your plan, right? And I think going through and understanding what other components that are already well taken care of, and then just, diving into the details of what we know and what the scripts are as much as you can for those components, and then flagging, what are the components that are not already taken care of, and how can we supplement that with partnerships, either with us, with UNICEF, with others, I think is kind of big picture really important, because a lot of this is going to have to happen in parallel given the both the crisis and your own timeline. So just kind of thinking big picture, kind of taking stock of that. We can do that together here, we can do it offline, but I think that would help even me understand like what the different pieces are and how we can help.
Yeah. So one thing, I don't know if this is relevant for this study, but one thing that has bugged me personally is the effectiveness of the education that has been conducted through, say, social media. So whether they are actually looked at or not, and how effective that education is. So I don't know if there's a way to marry that with this particular study.
Yeah, we actually we have created the social media collateral in Bangladesh with somebody who's at the Harvard School of Public Health, and and we were thinking of doing a Facebook campaign, but doing it in WhatsApp Facebook type campaign, but doing it in such a way that some sub-districts get it and not others, right? So yeah, it's I think that's an interesting question, and like whether or not this, because you're right of two things. One is that a lot of people are doing it, and second, we don't know if it works, right? And and so I think it's valuable to do it. I would say, okay, let me keep that in mind and see, like in any given location, whether it's in India, Pakistan, or Bangladesh, whether we can like just like vary that a little bit and then get some data on whether, on effectiveness.
Yeah.
I mean,
So-
I would imagine that's a bit part of the producing messaging materials. We would probably still expect that the importance of, the in-person reinforcement and the kind of door-to-door component of it with all the leaders is still important. So
Okay, let me actually give you a quick answer, Sahil. So you're right, we don't have the evidence, but let me tell you what the answer is. I don't think it helps, but especially by itself, I don't think it helps much. And the reason is, like, remember when I talked through the presentation of the research results, right? We tried a lot of these different types of nudging, right? We tried text message reminders, right? We tried like make a verbal commitment and then let's see if you follow through, etc. We tried a whole bunch of those things. All of those produce null effects. So my prior is, I don't think it's important, but.
Yeah, the only place that it could be a substitute if you're going at scale and you can't do for some reason door to door, which you would strongly recommend, then you could supplement by putting that same messaging on social media.
Yeah.
But I agree with Mushfiq that the main thing here was the intent to action gap. It's not that people don't know about masks. It's not that they don't know how to wear it correctly. It's that they don't actually wear it correctly at the point of the behavior. And so if there's one component I would focus on, it is that in-person reinforcement in the public spaces. That's really it to set the norms for mask wearing.
And when you do the information, right, like, you're doing door-to-door distribution and having a little conversation at the time, right? It shouldn't be a long conversation, just a little, maybe we leave a brochure for them, right? Or we have like a flip chart, we show them with some pictures as to why it's important, right? The fact of the matter is, if somebody comes to my door, like cares enough about this problem, such that they're handing me a free mask and telling me, please do this, right? That exact same message, if somebody sends it to me via WhatsApp, right? They're just two very different things.
Yeah. So then just one last question from my side, and then I'll keep quiet. If we are distributing the brochures of the masks or of the posters that we have created, is that method of education any more effective than social media?
No, I don't think so.
Yeah.
I think what I'm going to say is the following, right? The endorsement effect of somebody caring enough to give it to me, right? I think that's what matters. Now, if that somebody comes to my door and says, look, tell me your WhatsApp number, I'll forward you this, as opposed to I'll leave you this brochure, right? I don't think that kind of like the delivery style matters at all, right? As long as people are like, okay, this is somebody who came and told me about it, and so I should watch it, right? So there I would make the decision on the basis of whatever is logistically easier, right? If it's logistically easier for your staff to just like forward something versus show them a flip chart or flipboard, right? Or like leave a brochure, whatever's easiest, let's do it.
Yeah, I agree. I haven't seen any evidence in India that brochures, it ends up with a lot of printing, which, typically doesn't have, I haven't seen any evidence that it does work. There is some evidence, I think, that including Abhijit Banerjee's work, that some SMS and text reminders and some WhatsApp can actually have some effect, but there's definitely no evidence that brochures have a lot of effect. So if anything, I would say maybe some sort of flip chart that they show. And again, Gautam, thank you. I think that was the suggestion you had made. Some kind of flip chart that they showed at the door. And then maybe, actually, it might be interesting too, if you could get their numbers, if you're not coerced into getting the WhatsApp numbers, because then we could even run a short survey later on, and ask them about what they think about mask wearing or some attitudes towards COVID and see if that works. So ideally, I would recommend maybe doing that and maybe taking down their numbers and saying, do you mind if we send you this thing on WhatsApp? And then we can maybe even see how they transmit it to friends, right? One thing with WhatsApp is it can get very viral. So, are they sending this message? So that's what I would say. Brochures were, we did that in Bangladesh for the study, I think, to keep it at that level. But the main point is, as Mushfiq said, the signal that you send by showing that this is important enough, that we are coming to you personally, and then the reciprocity, because I have done that, therefore I should comply with this behavior. This person has taken the trouble.
And even then people forget, so you got to go back
Which is a reinforcement. Yeah, which is a reinforcement. So those two components, I would say, just getting someone to someone's door or contacting them personally, and then the reinforcement, which is why community organizations are so important, I think, in this intervention. It's not a mass media intervention.
So thank you, Sahil Bhai. Those are excellent questions. I think those are also things we have to continue thinking about, and we can go back and forth. And
so we made a note on the social media one for sure.
And questions like this, please feel free, like maybe we can exchange WhatsApp numbers, and I'll put it on the chat. And please feel free to just like send a quick question, however easy, and we'll try and give our reaction. And Rima Ben, I think you had unmuted to say something earlier, and we interrupted you. Sorry about that.
No, that's fine. I think I've forgotten what I was about to say. If it comes back, I'll come back to you, or I can send an email to you.
Okay.
Rima Ben, you had said traveling by monitoring team may not be feasible. Request if you can suggest some other mechanism. Is this just for the surveillance team or for the whole intervention team?
So I think the monitoring team, because it's for the current situation, not for always.
Yes.
But currently, when it's so much on the rise, the team may not be able to move from village to village or from district to district. Correct. So maybe some other, if you have ideas of some other mechanisms of,
So in that case, okay, I mean, this goes back to that conversation where Sahil Bhai asked about should we have separate people doing monitoring versus distribution, right? So this sounds like, okay, under this constraint, maybe we cannot separate them completely, right? So here's, okay, depending on the size of your team, okay? So imagine in a village area or in a district, you have 8 people. I'm just making it up, okay? So is it possible to have 7 people allocated to the task you plan to do, like distribution, and 1 person who's local, who is just in charge of monitoring, who just like dresses differently than the others?
I think the constraint, Mushfiq, was for that person to travel. Because
exactly.
It wasn't the person.
So maybe in every village we may have to identify one person who just does monitoring.
Yes.
Yeah, and I don't know whether this is a possibility, but I saw it in some other research that people uploaded photos via WhatsApp, and if that's a possibility.
So no, that's not. Let's not do that. That's too much. I think like we'll get a lot more data in 1 hour if there's just 1 person in the village. So
they don't travel.
Yeah, and let's, to the extent possible, let's try to keep that quiet, which is that, like, don't call him monitor, don't label him as him or her as a monitor, right? And then we just quietly give him or her that responsibility, and they just like send us information periodically, like using Google form or whatever.
Yeah. So Rima, does it answer your question on the travel?
Yeah, sure. So the leaders who would do the door-to-door visits and distribution, and the monitor would be very different, 2 different teams only. Sure.
Yes.
So in every village, then we'll have to have different teams that way.
Yeah, to minimize travel for everybody, I guess. Yeah.
And to what you were just referring, that if there are certain kinds of given the current situation, it may not have been the situation had we started this maybe 2 months ago or 3 months ago. But right now, everybody is in a very desperate situation. And so they may ask, can you also help me talk to a doctor to reduce the fees or the admission charges, or I'm not getting hold of the medicines. And there would be all kinds of questions that they will encounter. And unless they give them a satisfactory response, I don't mean to say we take on the responsibility, but you also need to give them some satisfactory response. Otherwise, they may feel that, oh, there must be some vested interest and therefore they are distributing the masks. So we don't want that kind of a perception to build upon.
Yeah, is it okay? I'm just brainstorming from the top of my head. This might be a very stupid idea, but just to get the conversation started, is it possible for us to have like some central phone lines, right, that are staffed by a couple of like knowledgeable people, let's say nurse types or community health worker types, right? So that when these questions come up, we can say, oh, here's a phone number you can call, and there's a person who can at least advise you. Of course, I mean, given the desperate situation all over India, it's going to be limited what a person on a phone can tell you, but at least they can advise you in small ways, like as long as we staff people who are knowledgeable and keeping good account of the information locally, right? Oh, here are the places that have oxygen tanks, or here are the locations, like the towns where there's a hospital that people have been able to get their family admitted to, or that from your local pharmacy, this is what you can get. Like, is that something that would be useful to do? And also, is that or we also don't want to do something dangerous where somebody gives advice that's wrong advice, right?
We do have a number which our members can always call if they want so, but I'm not sure of the advice because somebody has to be really knowledgeable on an updated situation as well. That if they shouldn't give a wrong information, you end up in a hospital and then there is no vacancy and so on.
Yeah.
But anyway, I think the experience only will tell us what
Right.
happens. So.
Yeah.
Right. And Rima, when a team of doctors has created you would have seen that, right? That schematic about how to manage it. It's been translated in various languages. And it's certified by the doctors. So I can send that and you can see from the doctors. But yes, I totally understand not giving medical advice. So it would be best to stick with either a helpline or some actual published information, which we can just hand out when doing the other work.
Sure.
Yes, Heidi, I think WHO, UNICEF should have some good ideas as well on guidelines, which we can check with them.
Because, right now the ground situation is horrible. One wouldn't have even dreamt of. One of my colleagues who's here on the call, Saira Ben, she was just sharing that, one leader, her aunt was so seriously in need of oxygen. She took her in a rickshaw and moved around the whole day looking for admission. And in the end, she lost the aunt because, in the rickshaw itself. So that's the kind of a situation. So that's why my questions were that people would ask all kinds of help. And I don't want that the women or the leaders who are going to distribute the mask get tangled into all those, because when person is desperate, they may come up with anything. So we'll have to, the first few days, one will have to be very, very actively in touch with all those who go to the villages. So.
Yeah, I'm really sorry to hear that story, and also, I mean, maybe we should have started the call with this. I hope all of you and your loved ones are doing okay. We're so caught up in trying to get this out.
Thank you. And that's why we jumped onto this as soon as we saw this, because anything that we could do to protect people from getting into a dire situation, we would want to do that. So
the way I think about the value of this, I mean, I'll just verbalize this in case you have to, convince others, right? Is that so the cities in India, I mean, it's already, of course, become overwhelming. Hospitals are overwhelmed, right? Beds are not available, etc., right? towns are getting there, or maybe have gotten there, right? And rural areas, the situation is probably a little better, right? But the risk here is that given the lack of health infrastructure as you get more and more rural, right? If the situation that we see, if the rates of infections that we see in urban areas starts moving towards rural, like then it becomes, I mean, right now it's already horrendous and beyond some of our imagination. But like after that, you know, we are talking like in rural areas, if this same thing happens, like we're talking about like scenes that we've only seen in history books, right? And so what the reason why I'm also, you know, we're also really eager to get this mass distribution going is that, you know, at least if it helps slow the spread, even if it doesn't completely eliminate the spread, right? But slowing the spread so that we take, so this is the idea of flattening the curve, right? That we just like spread out how quickly the virus moves so that in any given moment, it's not like the number of people who need hospital beds, the ratio of that to the number of hospital beds is like 10 to 1. Like at any given moment, if you can get it down to 2 to 1 or 1 to 1 or something like that, right? Then we don't end up having all these unnecessary deaths or deaths of the type, in the type of circumstance where, like you just described, where people are just dying on a rickshaw. Right?
No, I agree. And the situation in the rural areas is already worsened. So there would be hardly one PHC or a community health center, and then one or two private small clinics, but they are already overloaded. So, you know, one has to work very fast, very fast.
Very fast.
Can I just learn from your team, you know, given the excellent point you made earlier about like limiting movement and travel, right? So what's the plan for how are we getting masks to each of these villages? You know, what type of transportation is happening there, or is it that the masks are being produced locally inside the village?
Masks are produced in the villages.
Okay. Okay. So then we have like a separate team for the village itself. The mass production is local. The promoters are local, and they'll just do the local work. Okay, excellent. Okay, so we have to. We should go back to like this one task we might need to do is getting boxes of supplementary surgical masks, and getting those delivered to the various villages.
Sure, yes. And what we are also planning to do is open quarantine and COVID care centers. We have our community centers in the middle of the villages because people right now, when they don't get admission in the hospital, they are just lying in a jeep or in a car, and they are being treated with, you know, IV fluids in that vehicle itself, or they are just on the floor, or they bring pots from their homes and just are lying like that, which is a bit, you know, I mean, it's a desperate situation. So how could those centers be converted into quarantine or COVID care centers? So we're working with the health ministry on that.
Okay. Oh, there's some experience. Another country I work is in Sierra Leone, which had, you know, the unfortunate experience of Ebola. And they have a lot of experience with, you know, solutions like this, which is during Ebola crisis, they had to sort of be creative and create very localized facilities where you could isolate people and you could treat them. If it's of use, I could connect you to our team in Sierra Leone, and then they'll have connections to the health ministry there.
Oh, please, definitely. Yeah.
Okay. So Heidi, if you're taking notes, I'll have to connect her to Nicolo and get him to. Okay. I'll send that up. Okay. So what else should we discuss? Should we talk about any immediate next steps that we need to do? At least summarize what's on our plate and what's on your plate and what happens next. So what are the tasks that we've taken on that we need to deliver? Heidi and Neela. That's so one task is about, okay, this conversation about surgical mask procurement.
Yep. Another one is connecting them quickly with the Bangladesh team so that there can be kind of sharing of, you know, experiences and lessons and quick questions. Okay. Yeah, go ahead.
So Sahil bhai, if you can you just type up your WhatsApp number on the chat?
Sure. I'm sending.
Okay.
Mushfiq, the other one was just like creating that checklist or the pro forma for the observation.
Yes, I have that.
Okay. And actually we should, if possible, we should take it a step further and talk about like for any kind of smartphone based reporting. Right?
Who should lead that on our team? We can.
Yeah, let's check in with Bangladesh to see how they did the. Yeah, so Heidi, if actually, you know what, you know, at Northwestern in Chicago, they have the IPAs, like the data methods folks. I forget the name of the person who leads that, but let's check in with them and see if they have something that can easily be installed on a phone right away.
Or Lindsay for guards, she probably has something. Okay, yeah, great.
And then the situation, right? If there's material or if when people ask about COVID management, if there's something in WHO or UNICEF.
We should flag that and the surgical masks as gaps for UNICEF.
Yes. Yeah.
And anything else, I mean, if you as you're digesting all the information, because we understand we've shared a lot. So if you kind of go back to the high level and look at it and say, okay, what are the other gaps? And let us know what you identify.